What are the early signs of scoliosis to check for at home? Every case of scoliosis is unique, and the most common symptom when it comes to scoliosis in children involves postural changes. And when we look at home checks, the easiest thing to do is to evaluate your child's or patient's posture. And we want to look for is something like uneven shoulders, uneven hips, or some of the earliest signs of scoliosis in children. And remember, there's never a normal time for shoulders or hips to appear abnormal or asymmetrical. In addition to postural changes, we can look at uneven shoulder blades. We mean one shoulder blade sticking more out or further back than the other. We look at an asymmetrical rib cage arch, meaning the ribs kind of go back on one side and more forward on the other, and that's typically on the right side. You'll see this. Arms that can appear to hang at different lengths or have different spacing between the body. Also, the body is completely kind of out of alignment relative to the rest, meaning the torso not in alignment with the pelvis or the head not in alignment with the torso. In addition to posture changes, ill-fitting clothing can also be a sign, meaning that the leg length looks different, like the pants look longer on one side versus the other, or clothes don't sit properly on the patient. And these are all signs of postural problems, which could potentially be a sign of scoliosis. Now, when we look at what signs that adults can look for at home, things that we look for is not only posture issues and posture problems like we notice in adolescent cases, but it also tends to cause pain. So a lot of patients, the first sign or the first symptom could be pain because scoliosis becomes a compressive condition in the adult form. And since pain is the most common symptom, typically it's going to be dull muscle pain. Now, the problem is dull muscle ache in the beginning of the scoliosis progression is a common symptom. And a lot of patients without scoliosis may have dull achy pain. But the only way to really know is to have your spine further evaluated to see, is it truly a muscle problem or is it truly happening because of the asymmetry in your spine because of scoliosis? Back pain right along the lower back or the mid-back of the spine is also a common problem. And it can also be pain that also radiates into the extremities due to the compression of the nerve tissue that exit the spine, either in the low back or the upper back. Now, not only do patients can experience postural changes like I mentioned before, but they also tend to have more predominant leans. They can lean more to one side versus the other as the curve progresses, and the pain is typically the most common symptom that leads to an evaluation. Now, scoliosis in the adult form progresses slowly, so changes occur very slowly over time, and they tend to accelerate in older stage life, typically 50 plus years of age. Now, we know scoliosis, since it affects the spine, it can affect movement. So what ends up happening is spinal range of motion is significantly altered. And what I mean by that is that there's not going to be symmetrical motion. Patients may notice they can bend one direction way easier than bending another direction. And this could be a sign of scoliosis, especially if it's involving the lumbar spine or the thoracic spine. Also, since it's affecting spinal motion, it can affect changes in balance and coordination and gait. And if you see any significant balance changes or coordination changes, these are things that can be evaluated at home. But by far, the best thing is a postural assessment. If you're an adult with pain, you want to look at your posture and see if you're seeing any symmetrical posture. If you're a child with any type of ill-fitting clothing, you want to do a further assessment. And typically the assessment that involves evaluating a scoliosis, these screenings are typically performed by medical professionals, and it typically involves examining the spine and torso while in a forward bending position. And this is something called Adams forward bending test. And the reason why, because in this forward bending position, typically you can see trunk asymmetries better. And what makes scoliosis, it's more than just bad posture. It is causing an asymmetry in development of the torso. And this asymmetry is a response of the scoliosis becoming a structural problem. So therefore, for a parent or a caregiver, it's really easy to have your child kind of stand in front of you, evaluate the posture, look at the waist, look at the hips, look at the ribs, look at the shoulders, and then have them bend forward. And have them kind of round their spine and kind of look up the back of their spine and see if you see any differences in the height of anywhere between the pelvis and the skull. Do you see any height differences? Do you see the spine visually curving? Do you see the ribs kind of going more out or more back on one side versus the other? Any asymmetry is an abnormal finding. Again, unnatural curvatures to your naked eye, uneven shoulders, shoulder blades, hips, anything is something. When you find asymmetry, it doesn't always mean there's scoliosis occurring, but it definitely warrants further evaluation, especially in a child. Looking at this in the adult form can be more difficult because you can't bend over and evaluate yourself. So maybe you have a partner or a friend that can help you. Sometimes you can bend forward and have patients take a picture, or have somebody take a picture of you so you can evaluate your own spine in a photo. Now, really, scoliosis is diagnosed not only by looking at a postural evaluation and doing a physical examination, which includes a medical and a family history, and it also involves, like we mentioned, this Adams forward bending test. But the next step will always be further imaging. And typically it's a scoliosis X-ray. And typically a scoliosis X-ray will be taken to determine the official diagnosis. And this is done by assessing a Cobb angle. Another way a scoliosis is found is more often than not, it could be as a result of an image that's done for another reason. A person could be maybe experiencing some type of pneumonia and they want to evaluate the lungs and they take an X-ray and they see scoliosis. Or they have an injury or they have a car accident, they take an X-ray and they see scoliosis. Or they can just have an image for some reason and notice scoliosis in the background. And normally that's another way that scoliosis can be diagnosed outside of just evaluating posture, is through another image that potentially could occur. Now, we know there's no treatment guarantees when it comes to scoliosis because scoliosis, unfortunately, is a progressive condition and there's no cures associated with scoliosis. But we do know early detection associated with early intervention is definitely what provides the most benefit and the most options for benefits that are associated with conservative treatments. As a medical professional, when we look at scoliosis, we know that a doctor is needed to diagnose scoliosis. You cannot make this diagnosis solely by looking at yourself, but we definitely know that if you have signs of anything that we mentioned at home, you want to take it further by consulting with a medical professional to see if there is the scoliosis occurring, because the sooner you detect it, the sooner you treat it, the more likely there's going to be a positive outcome in your case. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.